Good afternoon, everyone. Thank you so much for joining us today for this episode of our Conversations with Caregivers series, The Importance of Sleep. My name is Heidi Kraft. I am the Chief Clinical Officer at PsychArmor and a Navy veteran, and it is my pleasure to be here with all of you today. We're so glad that you were able to join us to have this really important conversation. This series was sponsored by USAA, and we consider it an opportunity to virtually engage and learn with a fellow military and veteran caregivers about some of the difficult issues that have been exacerbated by the COVID-19 pandemic. These events are intended for military and veteran caregivers to learn together, discover new resources, change the narrative of their own experiences, and to build resilience. These virtual events will be recorded and will be posted to the PsychArmor website. A link will also be emailed to all attendees. Before we get started with today's webinar, I'd like to introduce our two guests who will be engaging in this conversation. First of all, it is my pleasure to introduce my friend, Dr. Bill Brim. Dr. William Brim is the director of the DoD Center for Deployment Psychology at the Uniformed Services University of the Health Sciences. He is a fellowship-trained clinical health psychologist and behavioral sleep medicine expert and leads the CDP Behavioral Sleep Medicine Training Team. Dr. Brim is an Air Force veteran. He maintains a clinical and forensic practice that focuses on treatment, assessment, and consultation with service members, veterans, and military family members. Bill, it's awesome to see you again. Secondly, I'd like to introduce Colonel Brian Vines. Brian is a fellow with the Elizabeth Dole Foundation, which exists to empower and educate military and veteran caregivers and to assist them with resources. Brian enjoys being an advocate for caregivers and finding volunteer opportunities to assist other veterans. Brian and Natalie met in the military and have been married for over 20 years. Natalie suffered head injuries in Iraq in 2005 and 2009, resulting in a traumatic brain injury, seizure disorder, cognitive disorder, severe migraine headaches, balance issues, and severe post-traumatic stress disorder. Natalie's injuries made it difficult for her to progress in the Army. In January of 2013, she was medically retired from the Army. Brian retired from the Army in 2012 in order to be a full-time caregiver for Natalie. Gentlemen, it is my pleasure to be here with you today, and take it away.
All right. Hello, everyone. Again, my name is Brian Vines, and I am just really excited to be here talking to you this evening. And first of all, just a shout out to all the caregivers out there, and just let you know that you're not alone. And I have so much respect for you, having gone through this journey on my own. And that's what I want to talk a little bit about at the beginning is my journey and how I kind of came to this point in my life as a caregiver. After that, I'll turn it over to Dr. Brim, and he's going to talk to you a little bit more about sleep issues. And then I'll pick it up again and talk to you about some best business practices, things that I've learned along the way that have helped me with my own sleep issues, which definitely impact being a caregiver for my wife. As she brought up in the introduction there, I spent 28 years in the Army. I loved the military, enjoyed it very much. Met my wife while in the military, and we've been married almost 21 years now. And it's been quite a ride and quite an adventure. We were last stationed at Fort Lewis, Washington, or Joint Base Lewis McChord. Some of you may recognize that name. And it was during that time that she received her second blast injury in Iraq and came home with a severe traumatic brain injury, a seizure disorder, cognitive disorder, and things that have been diagnosed since then that we didn't know at the time. She realized that she couldn't do her job, and it was very painful for her, something that she was very passionate about. She loved being a leader of soldiers, but she could no longer hide the fact that she had this cognitive disorder and seizure disorder, and it prevented her from being a good leader. At the same time, I'd come back from my second deployment to Iraq, and I was dealing with my own post-traumatic stress issues and how to deal with my own sleep issues, everything from nightmares to insomnia, hypervigilance. So we were kind of going through this together. And at first, I really didn't identify as a caregiver. I thought I was just being a loving husband and taking care of my wife and trying to do the best I can, educating myself on the internet, trying to help her as best I could. And it wasn't until I did an event with her with Wounded Warrior Project that I began to identify as a caregiver and found out there were many more out there just like me. And if you're familiar with the 2014 RAND study on caregivers, they estimate 5.5 million military and veteran caregivers in the United States. And the definition of caregiving and the demographics of it have changed over the years. Whereas in the past, a lot of times it was siblings taking care of perhaps their World War II, Korean, or Vietnam era veteran, or a spouse taking care of a veteran. Now you had not only spouses, but you had adults taking care of their sons and daughters. You had battle buddies coming back and volunteering to take care of their battle buddies. So the demographics have changed a little bit. So anyway, I found myself in the caregiver role, and I learned about the Elizabeth Dole Foundation, which, as mentioned in the introduction, it's an organization that exists to help empower, educate, resource, and respect caregivers. And there are both male caregivers and female caregivers. And at first I was kind of intimidated because there were so many more caregivers that were female than the males that identified as caregivers. But once we realized we were all kind of doing the same thing, I was accepted into the, what would you call it, into the caregiver community. And it's been very helpful for me. And as I'm sure you know, that caregiver fatigue is real, and how important it is to reach out and talk with other caregivers and to share those best business practices. So I'm going to leave it there just for a moment. We'll turn it over to Bill. And then when I come back to you, I'm going to talk about some of my experiences and practices that may help you with your own sleep issues. So take it away, Bill.
Thanks, Brian. Hi, everyone. I was really honored when Dr. Kraft and Dr. Rogers reached out to me to ask me about doing this webinar. And at the time when Carrie reached out to me, I don't think she realized that she had impeccable timing. My mother-in-law had just passed away a couple of weeks before from liver cancer, and the last 3 months had been pretty rough for her. And my wife and I, and like Brian, I never would have thought to use the term caregiver at the time. And it wasn't until Carrie reached out and we started talking that it kind of sunk in that I was kind of a caregiver for a few months. And those last 3 months were in particular pretty rough. My wife and I would spend 4 or 5 nights a week over there, and then I would work during the day, and then my wife would spend 2 or 3 nights over there, and we would kind of trade off back and forth. And those nights were rough until the very end. She was quite often up during the night and would sleep during the day. She would need water. She'd need to go to the bathroom repeatedly. So we'd be up 10, 20 times a night, lifting her out in the hoist and all that kind of stuff to use the restroom, for example. Sleep was very disrupted, to say the least, right? So I guess I just had a small, short window into what some of the struggles are that caregivers deal with, and the potential disruption to sleep in particular that is so common. And of course, all this was worse because COVID and many of the things that you guys experienced, the reduced resources, trying to keep our bubble protected. Needless to say, I was happy to have this opportunity to talk with folks. I first got into sleep when I was a little baby. I guess I'm just kidding. Everybody got into sleep when they were a baby, hopefully eventually. I got into sleep. I'm a clinical health psychologist, as Heidi mentioned, and I've been studying and treating sleep since graduate school, a little over 25 years ago, I guess. And in my current work, we spend a fair amount of time training providers to work with people that have sleep disorders. And we spend a lot of time consulting with military commanders about how to manage sleep disruption, how to manage shift work, how to manage the sleep disruption that occurs during deployment and the like. And the sleep disruption that caregivers deal with reminds me a lot of my experiences with deployment, with sleep on deployment, or with shift work. And really, we have to focus on how do you manage the impact of those experiences? How do you manage the impact of caregiving or shift work or deployment on sleep? And we know that sleep problems are one of the most common concerns that caregivers have. Let me actually, I have an idea. Let me share my slides with, let me share my screen with you guys. I have a slide I want to share with you. And we'll take a look at this real quick. So you should be able to see this now. It's the National Sleep Foundation's duration recommendations, and I think you can probably see my cursor. So down across the bottom, you see newborn, infant, all the way up through young adult, adult, and older adult. And then in the light blue and dark blue, you can see the recommended kind of range for sleep. So you can see that, so for example, a young adult like myself and Brian, actually, I guess I would count as an adult. The range for an adult is 6 to 10 hours. Lots of us have heard about you have to have 8 hours of sleep, but that's just an average, right? The range is the recommended range for an adult is 7 to 9 hours, right? So what I'd like to do, we have this thing we do called Slap Me Some Whys where I work. So what that means is we ask you in the chat to type the letter Y for yes or the letter N for no when I ask you questions. So I'm going to ask you a question, and my question is, find your age group across the bottom there, and then let me know yes or no. Do you consistently get the recommended number of hours of sleep? Consistently get the recommended number of hours of sleep? No, 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 no. No, 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 maybe a yes. There's a couple of yeses. Good for you guys. No. Okay. All right. Yes, but not uninterrupted, right? Exactly. No, no. Some yeses. All right. That's good, right? So the good news is that apparently you all are pretty normal for caregivers. What we know is that nearly 100% of caregivers report at least occasional sleep disruption. About 50 to 80% report at least some regular sleep deprivation. And we know that anywhere from 27 to 50% of caregivers report symptoms consistent with insomnia. And we know that the problem for caregivers in particular is also underreported and undertreated. So what I want to do again real quick is I want to just briefly highlight the difference between those categories that I just mentioned, because I mentioned sleep disruption, sleep deprivation, and insomnia. Sleep disruption is just what it sounds like. It's interrupted sleep. It's when sleep occurs, but it's not condensed. It's not consolidated into a solid, that 7 to 9 hours of recommended sleep, for example, for an adult. It's not consolidated. You don't go to bed and wake up 7 to 9 hours later. It's disrupted. You have problems falling asleep, waking up in the middle of the night and not being able to go back to sleep, or waking too early, for example. That's sleep disruption. Sleep deprivation is when you don't give yourself enough opportunity to sleep, right? And that can be because of you have lifestyle choices, work, caregiving responsibilities, childcare, whatever those are. And it may not be like conscious, it may not even be voluntary per se, but just kind of things nibble away at the edges of that 7 to 9 hours of sleep, so that you end up maybe having 5 to 6 hours of opportunity. Now, when you get in bed for that 5 or 6 hours, your sleep is pretty good. It's consolidated, and you're able to sleep that 5 or 6 hours. But sleep deprivation is when you're not giving yourself enough opportunity, but you have the ability. And then the last thing is insomnia. And insomnia occurs when there's lots of opportunity, where a person may be giving themselves 8, 9, 10 hours of opportunity to sleep. But when they give themselves that opportunity, they don't have the ability to sleep. They They can't fall asleep, they can't stay asleep, or they wake too early. And that's insomnia. And they're not all mutually exclusive, right? So you can be sleep deprived. You can only give yourself 5 or 6 hours of sleep per night opportunity. And during that 5 or 6 hours, you still have problems falling asleep, staying asleep, or waking too early. So you can have both. They're not mutually exclusive. But I wanted to highlight that they're different because all of these can be addressed, but they're addressed in different ways, right? So sleep disruption or sleep deprivation is not treated the same way that insomnia is, for example. And so I just wanted to take a second to kind of lay that framework out there. And I guess I wonder, Brian, does any of that resonate with your experience as a caregiver? And what suggestions do you have from your experience?
Okay, sorry about that. Had to unmute myself. But yes, I do have quite a bit of experience with that. I think that as caregivers, it's a difficult job for us because you are 24/7 putting the needs of someone else before yourself. And that can take quite a heavy toll on you. And consider that being exacerbated by I'm not getting enough sleep, or if the sleep I'm getting is not quality sleep, or I just can't go to sleep at all because I wake up during the middle of the night. And so if you're not in the best, mental, physical, emotional, spiritual shape that you can be in, then you're probably not providing um, the amount of care to your care recipient that you would like to. And I think that's important. And part of that being fresh spiritually and mentally is ensuring that you make time during the day. Just we call it me time. It may be just a matter of checking some Facebook messages uninterrupted, or it may be this time of day I'm going to step out and I'm going to go for a run, or I'm going to go and work in the garden. But those little mini respites, I'll call them, are important for your own mental health and being able to help your care recipient, your veteran or your military wounded warrior. And the other thing is more intentional and purposeful respite, and that is either planning a trip of your own, where you get some time to kind of reboot your brain and rest, so you can come back as a better caregiver, or going to a more formal respite, be it through the Independence Fund or Wounded Warrior Project or several of the nonprofits that assist caregivers with respite. And I know it's difficult to find time for respite sometimes, particularly if you're working 24/7, taking care of your care recipient. And on top of that, you're taking care of the family in the house, and you're either working inside the house or outside the house. And now you're tired all the time because you're not getting enough rest. You're probably not doing the job you'd like to. And if you are, you're just painfully getting through it. So I wanted to share some of the best business practices that I've learned along the way. Some of these are not necessarily ones that have worked with me, but I know they've worked with others. And not all of them will work in everybody's case. There's no cookie cutter approach. You have to just kind of find those things that you can do in your situation that benefits you and also allows you to give the best care you can to our nation's resources, its people. And part of that is making sure that you have a good sleep environment. And a lot of us kind of take this for granted and say, oh, I don't need, a good sleep environment. I mean, how does that benefit my sleep? Well, picture if you have lights outside, or you wake up and the sun is in your face in the morning, you can't sleep through that. It wakes you up. So consider doing such things as putting in blackout curtains to block the sun's light, or to block outside lights, perhaps outside your house or your apartment. Other things that you can do is not only darkening the room, but trying to eliminate a lot of the noises that are going on, either inside your room or outside your room. And there's several different ways you can do that. You can get a machine that plays white noise. You can get relaxing music that you like. A lot of times it's better to do instrumental type music as opposed to music with words to it. Or you may be a type of person that likes to go to sleep during a thunderstorm, so you can listen to some storm noises. Now, your veteran perhaps doesn't agree with you on that, so you may have to go to a sleep mask and headphones in order to deal with that. Particularly if your veteran has a CPAP or any other type of noise-producing hospital equipment, that you want to make sure that you've got the right environment for you to help you go to sleep. Another thing is try to avoid going to sleep with either the TV on or with music on, because it tends to stimulate the brain and you get caught up kind of what's going on TV, and it stimulates the mind, and then you're thinking about what's going on TV, and you're not relaxing. Anything that stimulates the brain can delay you in falling asleep. We say for the bed that just keep the bed to the 3 S's. The 3 S's being sleep, sickness, and sex. Otherwise, don't lounge in the bed, because that again can lead to poor sleep behaviors and not help you go to sleep. Consider uncaffeinated drinks, and maybe instead of like decaffeinated coffee, maybe try decaffeinated tea if that helps you go to sleep. Anything to help you relax. But avoid caffeinated drinks, and try to avoid any type of fluids, or at least a large amount of fluids, within 2 to 3 hours of going to sleep. Because if you're a senior adult like myself, a little bit of fluid and you're getting up 2 or 3 times during the night, and that definitely disrupts your sleep. I've got a few more that I'll bring up at the end, and I'm going to turn it back over to Bill for his comments.
I think those are great suggestions, and I can throw some more in there, and then I might also talk a little bit about the origins of why some of this is a problem, and what some of the ramifications can be, or some of the symptoms that you might look for. One thing, and I'm going to get laughed out of the room as soon as I say it, but probably one of the most important things that you can do for your sleep is to try and maintain a consistent bed and wake time. Having a consistent bed and wake time to the best of your ability is key. And now I want to expand on that a little bit and talk about so what can you do in a situation where, like shift work, like deployment, like a caregiver, where you may not have that, kind of consistency, is sometimes in these situations. So instead of treating the problem, we're trying to manage the problem. We're trying to minimize the impact. So what we have to look for is opportunities to have as much consistency as possible. So probably many of you have started to recognize patterns in your caregiving, right? There are times when you're really busy, and there's times when you have quiet time. Maybe you have recognize that there's patterns to when your care recipient is sleeping. Maybe there's opportunities during that time when they are quieter and they have less needs, and that maybe can be when you have your self-care time. One of the things we often talk about is wanting to make sure that you don't nap, right? When you have insomnia, for example, we don't want you to nap. And I won't get into it in this hour about, kind of why we say that, but that's for insomnia, right? Remember, I said we treat these different things, insomnia, sleep deprivation, and sleep disruption, differently. So with regard to naps, if you can't get that consolidated 7 to 9 hours of sleep at night, if you're an adult, if you can't consistently get that 7 to 9 hours of sleep, some sleep, even if it's not consolidated in that 7 to 9 hours, is good. So nap, either take power naps when you have the opportunity, or take scheduled naps. Again, when you recognize that this is a quieter time, that you can grab a nap, then have a couple of hours of nap, especially if your night sleep is disrupted or routinely disrupted. What I would recommend with regard to naps, though, is that if you take naps, try and keep them as far away from your biggest period of sleep. So if that's still at night, if you have an opportunity to take a nap, that's great. But don't do it too close to bedtime, because then what will happen is you'll get into bed and you will have burned off some of that sleep hunger that you naturally would have had. And so you won't be able to fall asleep when you get in bed. Um, One of the other things that I actually saw it in the chat earlier was somebody had mentioned, and this is really common, that when they go to lie down in bed, their mind like instantly takes off, right? It's like you know you're falling asleep on the sofa, nodding off, and you like literally like elbow crawl your way to bed, and as soon as your head hits the pillow, your mind just starts kind of racing and thinking through things, and that's a really common problem that people both with insomnia and with sleep disruption have, and one of the recommendations for that is because what's happening is you're so busy, so rushing around all day trying to deal with different things that you never actually have some downtime, some respite, as Brian was saying, and even a short period of respite in order to just kind of quiet your mind and let all that activity happen. We call it worry time, right? So we actually recommend that people set aside 10 to 15 minutes outside of their bed and bedroom, right? Not in your bed or bedroom, and just sit down, maybe even get a pad of paper and just turn off the phone, tell anybody, turn off any distractions, and then just kind of do a brain dump. Get all those worries, get all those thoughts, make a list, a to-do list, whatever it is that's running through your head when you're lying in bed, get that out of your head outside of your bedroom. Have that worry time, and then you can tear that sheet up, you can wad it up, you can set it on fire, you can have a seance, you can do whatever you want, but you leave that behind, right? Then you can maybe take a few minutes to do a deep breathing exercise or some kind of relaxation exercise, kind of put that worry away. You've written it down, right? And then if you're ready for bed, you can brush your teeth and wash your face and put on your pajamas and get in bed. And if your mind starts racing again, then, like Brian said, don't spend time in bed awake. The bed is for sleeping, sex, or if you're acutely ill, right? So if you're not sleeping in the bed, get out of the bed. So if you lay down and your head starts racing again, get out of bed and go have another worry time, and then relax for a few minutes. And then if you're ready and feeling sleepy, go back into the bed. Because what we don't want is to associate the bed or the bedroom with being awake and frustrated and anxious. Because once you make that bond with the bed almost becomes a trigger for worry and anxiety. And we don't want to start that pattern. So that's a couple of things. I don't know if Brian, did you have some others on your list of best business practices?
Sure, I'll throw some of them out there. And I'm sorry, the setting sun is in the window behind my head. It almost looks like a halo, but let me assure you it's not. Uh, anyway, hey, the other thing I want to do is that we've gotten a couple of good questions in, and I wanted to make sure we hit up those questions before we conclude this afternoon. Melissa, you asked, are there any devices that can help with sleep disruption? I am not aware of that. I think Bill may have some better ideas on that, and I'll turn it over to him here in just a second. And an anonymous attendee asks, is there any advice for dealing with parasomnia? And I had to look up parasomnia to see what it was. So I kind of looked down and Googled it. But yes, there are so many different techniques that you can use. And this kind of gets into Julie's question also that she asked about. She's tried many of these techniques and it hasn't allowed her to get over her insomnia and her sleepiness. So if you find these don't work for you, don't rule out going and seeking professional help. Go and see a mental health professional. Let them know about your sleep issues, and they have a whole host of techniques and I'm sure devices that they can provide that can help you get through your sleep issues. Sometimes it's just not good enough. What we could do is caregivers, and I'm going to pass it back to Bill and let him address that while I try to deal with this light behind my head here.
Thanks, Brian. So I guess I'll kind of address them. Parasomnias, there's a range of things called parasomnias that are basically things that happen alongside sleep, right? So parasomnias are things that happen during the sleep period. And there are things like sleepwalking is a parasomnia, talking in your sleep, night terrors are parasomnias. So that's just some of the different parasomnias. We won't go into the treatments for all of them right now, but what I will tell you is that most people that have parasomnias as adults had those parasomnias as children. So if you were a sleepwalker and as a child, you're at increased risk of being a sleepwalker as an adult. And what we know is the number one trigger for parasomnias in adults is stress, right? So when you're under stress, you're much more likely to experience those parasomnias, whether it's night terrors, sleepwalking, talking in your sleep, any of those types of parasomnias are exacerbated by stress. They can also be exacerbated by sleeplessness, so sleep deprivation. So it becomes kind of a vicious cycle, right? So one of the best things you can do if you're experiencing a period of parasomnia is try and identify what the stressor is, minimize that stress, engage in some relaxation techniques, those types of things. And certainly, if it's a big enough problem, I would not hesitate to go see your primary care provider. Let them know what's going on, and hopefully they can prescribe, like in a lot of parasomnias, just a very brief period of taking a benzodiazepine, some kind of anti-anxiety type of medication, for example, will break that cycle and allow you to get back to sleep, and it'll go away. Now it'll come back if you have problems again with sleep or stress or those types of things. But a brief, I keep saying brief because I don't think you need to get on a benzodiazepine permanently, because that's not a treatment, but it can break that cycle for the parasomnias. Um, Devices, I'll tell you, there's not a lot of devices that have actually proven to be effective. If you would like to try a device, there's certainly a lot of them out there because a lot of people experience sleep problems and they're looking for some kind of device to correct the problem. If you find one that seems like it's going to work for you, then try it. But if it doesn't work, that doesn't mean you're broken or helpless or there's nothing you can do. These devices tend to work very kind of idiosyncratically and very kind of heterogeneous. They may work for you, but they may not work for somebody else, right? So I don't say, oh, don't do that because there's no evidence to support it. Try it, and if it works for you, that's great. But it doesn't mean that the problem can't be solved another way. And then I agree with Brian 100% with regard to treatment, especially for any of these issues, but especially for insomnia. If you suffer with insomnia, there is a very powerful evidence-based treatment called cognitive behavior therapy for insomnia. And none of these tips that we've talked about make up cognitive behavior therapy for insomnia. So if you've tried all these things, if you've tried every single thing that we talk about, that doesn't mean that your insomnia can't be treated. Go talk to a psychologist, social worker, a professional who's trained in cognitive behavior therapy for insomnia, because medical providers, physicians, as well as mental health providers have all kind of recognized and come out clearly that cognitive behavior therapy is hands down the gold standard treatment for insomnia, and should be tried even before sleep medications in most cases. So there are certainly effective treatments and interventions that we can do for all these kinds of things. And the first thing you have to do is kind of, as Brian said, you have to kind of reach out and let somebody know. And I just want to take one more second and kind of put this in a little bit of a bigger context. And my dog is cheering. Um, and really foot stomp how important sleep is. Because here's the problem: we are genetically and biologically built to sleep, to need that 7 to 9, as adults, to need that 7 to 9 hours of consolidated sleep at night, right? There's 100,000 years of evolution that have, since we gave up night vision in order to see colors, we have been daytime creatures, right? We sleep at night, and our sleep is intended to be 7 to 9 hours of consolidated sleep at night. If you're not consistently getting that, it is causing physical, mental, social, and cognitive health stressors for you. Poor sleep is related to a range of adverse health outcomes and poor quality of life. One of the most common complaint of caregivers who have sleep problems is depression. followed by anxiety, but there's also metabolic issues. So obesity, gastrointestinal problems like irritable bowel syndrome, gastric reflux, IBD, ulcers, increased cravings for food, because when your brain doesn't get enough sleep, it releases a hormone that causes you to actually crave food. That can be a problem. High blood pressure, chronic fatigue, chronic pain, impaired relationships, increased cancer risk, both colon, breast, and prostate can be a problem. There's safety issues at home, work, on the road, attention, concentration, memory. Poor sleep has been tied directly to an increased risk for Alzheimer's disease. So you Sleep is one of those things that we all, I think, take for granted. And in the military, it's one of the few things I've actually heard this conversation between military members. I only need 6 hours a night to sleep. Oh yeah, you need 6 hours, huh? Well, you're a real wimp because I only need four. Oh yeah, you both are wimps. I only need two, right? It's like manly to not need sleep, in a non-gender specific way, right? But it's like sleep is one of those things that we take for granted, and it undergirds and supports all of our health. Again, our social, physical, mental, cognitive health hinges on getting good sleep. So if you're having a problem, like Brian said, let people know, let someone know that you're having a problem, because most of these issues can be addressed, or at least we can minimize the impact. Brian, any thoughts on that, or any other ideas for your business practices?
Yeah, I was just going to add a couple more here, and I'll try to go quickly because the Big Kane is going to come out and drag us off stage here pretty quick. But one thing that you touched upon, Bill, was trying to go to sleep and wake up the same time every day. And I would add to that, it's important to set up boundaries for your care recipient, for any family member or friends that may live in the house or may be visiting, to try to set that good environment for going to sleep. Something that has helped me is a weighted blanket. I find it's very not only comforting, but it makes you feel secure. It helps you go to sleep. It takes away a lot of the tossing and turning that a lot of us do. Another one, and this is kind of a no-brainer, but and easier said than done. But try to go to bed not being angry. If you've had a serious argument with with kids or with your care recipient or a family member, try to put that aside and get as much resolved as you can, so you don't try to go to sleep with your mind being overly stimulated. And I wanted to just quickly, a couple of questions that came up. Darla asked, any recommendations for those of us who have to get up every 2 hours during the night to take care of our loved ones? This is something that I went through. It's hard. It's like being on shift work or jet lag. And the only thing that I could share with you that helped me was organization. So that I knew if I was going to get up, at a certain time during the night or several times, I had stuff laid out so that I had a pill cup to give her medicine, and in the water setting right there. And as soon as I got that done, I'm back in the bed. And so having a routine and preparing for that stuff will help you out a lot. Shania asked, can sleep tracking devices and the data they track help if folks head to a clinician for help? And I would say any of the type of sleep tracking devices that if you could share with your clinician is helpful to them, so they can dissect not only how many hours you're getting, but the quality of sleep you're getting during those hours. And then last of
I
all,
can
oh, go ahead, Bill.
Yeah, I'll just jump in on both of those real quick then. As far as recommendations, if you're having to get up every 2 hours, yeah, that is the definition of sleep disruption, right? The most important thing I can say with that is, if you're able to get back in bed and fall back asleep after that disruption, then by all means, you're doing what you need to do. But go back to what I said earlier, we don't want to associate the bed with being awake and being frustrated or worried. So if you're not able to get back to sleep, if you get out of bed, you take care of your the person, and then you get back in bed and you're not able to get back to sleep, get out of bed. use that as some self-care time. Some people have mentioned take a bath. You can read a book. You can do something to wind down. You can do your relaxation exercise, but don't lie in bed awake. That's key. As far as the sleep tracking devices go, I'll tell you, the most important thing to me as a clinician is not what the device that you are wearing tells me, it's what you subjectively experience. So regardless, so I think that information is great. Go and share it with your clinician, absolutely. But what most clinicians are going to ask you to do is keep a log of your subjective experience, not your objective from a device, but your subjective experience of your sleep, and that will be key. And then I did make a note that I noticed that uh, Richard, I think, had mentioned exercise, and that's another good thing to keep in mind. Exercise is a double-edged sword. So I'll tell you again, like Richard seems to be able to exercise a little bit before bed, and then that helps him kind of glide into bed. And if that works for you, that's great. In general, we recommend that you absolutely exercise, but you try not to exercise any closer than 3 or 4 hours before bed, because naturally, biologically, what's happening in our body when we sleep is our body temperature is going down, right? And if you're getting ready to get in bed and you get your body temperature up by exercising strenuously, then you're giving kind of mixed signals to your body. Exercise is absolutely key. Fit it in where you can, even if you just have to do squats while you're cooking, or wear leg bands, or use whatever you can do to fit in exercise. That's key. Try and avoid it too close to bed. But again, if it works for you, Richard, don't stop because exercise is good, and being able to get to sleep is good. And then I noticed that somebody had mentioned about restorative sleep. Is there anything I can do when I've had a bad night's sleep to restore sleep? Sleep is tricky. You can't bank sleep, right? You can't say, oh, I know I'm going to have a sleepless night tomorrow night, so tonight I'm going to sleep for 12 hours, right? We can't force ourselves to sleep longer, right? So you can't bank sleep, but you can get restorative sleep. So one of the things I recommend to caregivers all the time is that if you've had a particularly bad week, if you can find an opportunity, find somebody, another caregiver, find some way that you can get one night of uninterrupted, just don't set the alarm clock, turn off your phone, don't let anybody disrupt you. And if you can get a good solid 8, 9, 10, 11, 12-hour restorative sleep on a regular basis, that does wonders for you cognitively, but it also can help restore some of that physiological imbalance that occurs from sleeplessness as well. So don't try and bank sleep, but definitely try and get a restorative night's sleep, and then get back into your consistent bed and wake time as best you can after that.
So we're kind of coming to the conclusion here, and I just wanted to make a few kind of brief comments, and then pass it back to Bill, and then we'll pass it to Dr. Kraft from there. But this has been a pleasure for me to kind of share my story and share some best business practices, things that I've learned along the way. And I would ask each of you to play it forward, to be involved in other groups of caregivers, to share with them some of the things that you've learned along the way, and accept the things that they've learned along the way. As I said at the beginning, there's no cookie cutter approach that applies to everyone, but everyone has something to contribute. And it's comforting to know that there are other people out there that are just like us, going through the same turmoils and same difficulties. And I, for one, just want you to know that I appreciate what you do, taking care of our men and women that have been injured, or have a sickness or whatever illness. Whoever finds yourself in your situation, thank you for what you do, and God bless all of you. And I'll pass it over to Bill.
I will echo that, and you probably should still have that halo over your head, but I will echo what you say, and I'll also I'll mention that, by definition, I think caregivers make pretty poor care recipients sometimes, and self-care is though key. And so if I had one last thing I would recommend is that take care of yourselves, because you can't take care of your care recipient if you're not taking care of yourself. And so, you know, try not to shortchange your sleep, and get regular medical checks, and make sure that the physician knows to do lab work, that you're at risk for GI or cardio types of things because of sleep disruption. And if you're having problems sleeping, let somebody know, because as I said at the beginning, there's things we can do to help with sleep disruption, sleep deprivation, and insomnia. But we can't help if we don't know, because like I said at the beginning, we know that sleep problems are highly underreported in caregivers. So take care of yourselves as well. And thank you for this opportunity.
Thank you so much, Bill and Brian. You are exactly right from the point of view of a clinical psychologist who does take care of caregivers. Totally echo what both of them said. Please do take care of yourselves. You matter very, very much. Thank you so much for joining us this evening. Sorry, we're not in the weekend yet, for a wonderful conversation. Bill and Brian, thank you both very much for providing us with your expertise and sharing your experiences with us this evening. If you have any questions, you can email support@psycharmor.org or reach out to us through our clinical support center on the website at psycharmor.org. You'll also receive a brief survey in a follow-up email. We would greatly appreciate a few moments of your time to give us your feedback so we can make any changes to further conversations with caregivers. That's it for tonight. We really look forward to seeing all of you at our next Conversation with Caregivers webinar soon. On behalf of all of us at PsychArmor, thank you for everything you do and have a wonderful evening.